Hello, my dear friends. Hope you had a wonderful day so far. Today, I'd like to talk about few studies regarding metabolic syndrome and metabolic health. According to CDC, last statistics, 70% of people, Americans, are overweight, and 40% are obese. 1 out of 3 people are in pre-diabetic stage without knowing it. And if no intervention happens in their life as far as nutrition and lifestyle changes, those individuals will progress to full-blown diabetes. The problem is that anything associated with high sugar level in our blood is the big risk factors, for, let's say, for cardiovascular health, for brain health, for mitochondria health, causing cancer problems, causing dementia and Alzheimer, causing heart attacks, heart failures in end stage of diabetes, these kind of issues. And in the beginning stages, disrupts our sleep and quality of life, and it always makes you fatigued and tired and all kind of issues. So the problem with this metabolic health intervention has becoming really prevalent these days, because you see a lot of people are being diagnosed with diabetes issues. As we said, 1 out of 3 people are in pre-diabetic stage. So it is really important to monitor our glucose level very, very often. The other thing is that a lot of diets focus on the amount of macronutrients. Let's say on how much fat you had in your diet, how much protein you had, how much carb you had, and less of attention on micronutrients. Micronutrients are like vitamins and minerals, which are really, these are the most important phytonutrients for us and have an essential role in metabolic health. And especially people who are having issues with weight loss, so they continuously having weight gain, it is because of those deficiencies that led to metabolic dysfunction. So I'm reading few studies for you in PubMed.gov regarding some of these important nutrients, like vitamins and minerals that we are talking about. These studies are all done in PubMed. PubMed is a medical search engine. It's not the research that goes in PubMed.gov. It is not theoretical. It is not experimental. It is peer-reviewed. So if you want to always look for validity of any study, always go to PubMed.gov. That is almost every physician reference is, as far as research is PubMed.gov, and everybody else is, it's easy, it's free. You can just, on the search box, you can type whatever you want, and then the studies, you see tons and tons of studies. So the first nutrient is magnesium. This study says dose-response relationship between dietary magnesium intake and risk of type 2 diabetes. A systemic review and meta-regression analysis of prospective cohort studies. So as you know, as much as 700 reactions, enzymatic reactions in our body happens by magnesium. Our genes, DNA, RNA, and protein structures and building proteins are all happens in the presence of magnesium. As you know, magnesium, like Epsom salt, as you have heard, magnesium is for relaxation, is magnesium sulfate. So it's for relaxation. Magnesium helps for sleep. So it helps for normalizing blood sugar level, as per this study approves, and our bone health. Magnesium and vitamin D and vitamin A and E and K, they all help with bone strength in our body. So in this study, they saw that each increment of 100 milligram dose of vitamin supplementing magnesium led to 8 to 13% reduction of risk of type 2 diabetes. So it is amazing that now research is approving the intake of magnesium. So you can have your magnesium through food, or you can have through supplementations. So it is really important to have your green leafy vegetables as the main source of magnesium. The second study is about magnesium. It is not related to directly related to metabolic, but I just didn't want to just keep it for myself and not share it with you. And that is saying that effectively prescribing oral magnesium therapy for hypertension, a categorized systemic review of 49 clinical trials. So in this study, they saw that taking more than 600 milligram a day of magnesium is helping safely lower blood pressure in untreated hypertension patients, hypertensive patients. The vast majority of people are not taking magnesium, are not eating green leafy vegetables. So most people are deficient in magnesium. In 2021, 2 years ago, there was another study that proved that men should take as much as 600 milligrams of magnesium, and women should take as much as 500. This is the minimum dose. Again, magnesium are in green leafy vegetables, in nuts and seeds, pumpkin seed, in nuts, almonds, cashews, spices, green leafy vegetables of the sea vegetables, and cacao also is full of. So unsweetened chocolate can be sourced. If it is sweet, then it doesn't help your magnesium absorption. So the second mineral is chromium. And this study says scientific review the role of chromium in insulin resistance. And it showed that chromium intake helps controls the glycemic issue in people with type 2 diabetes. Another study says effects of chromium supplementation on glycemic control in patients with type 2 diabetes. A systemic review and meta-analysis of randomized controlled trials. That study was done in November 2020. So in this study, saying that 200 microgram daily of chromium is enough to keep the chromium in optimal level in order to help with the issue of pre-diabetic and basically help with the balancing blood sugar level. The last one, and very important, is vitamin D. In this study, impairment of vitamin D nutritional status and metabolic profile are associated with worsening of obesity, according to Edmonton Obesity Staging System. Edmonton Obesity Staging System is a system that created by Obesity Society, if I'm not mistaken, Obesity Society. And in internet, they have a journal, International Journal of Obesity. They divided the obesity to 5 stages. Stage 1 basically is a person who has no physical manifestation or a psychopathology manifestation of having this blood sugar malfunction. Stage 1 is somebody who has subclinical risk factors like borderline of everything, hypertension, fasting glucose, and they have some mild issues as far as mental and emotional well-being, feeling fatigue. And stage 2 is more advanced. They are diagnosed with type 2 diabetes. They are diagnosed with hypertension. They are diagnosed with sleep apnea. And they have a bunch of other like anxiety and things like that. Stage 3 is more at the level of organ damage, like they have heart attack, myocardial infarction, they have heart failure, they have kidney failure, these kind of issues. And stage 4 is somebody who has severe end stage disability. So so with this, according to this system, Edmonton staging system, that insufficient amount of vitamin D, it is a risk factor for metabolic profile and worsening of obesity. So basically, vitamin D is in 90%, according to Linus Pauling Institute, 90% of Americans are low on vitamin D, 90%. So you can get your vitamin D in three ways. Sun exposure. You can just receive sun, expose your skin, your arms, your legs, your face to sun every day, as much as 10 to 20 minutes, which this and areas like East Coast or Boston, places that are like cloudy most of the time in Europe, these kind of places, it's hard to get that 20 minutes of sun every day. So they can get it through food, they can get through supplementation. So food, supplementations, and sun exposure. So according to this study, 2,000 international units a day is something that helps you to increase your vitamin D level. And if somebody has pre-existing conditions, they need to take more, 5,000 to 10,000 of international unit daily. But you have to check your vitamin D. If you're taking more than 2,000 international unit, you have to have your blood test done every 6 months to see your levels, because vitamin D, anything over 100 international, 100 milligram per deciliter is toxic. And so vitamin D is kind of interestingly works with a couple of other vitamins, such as vitamin A and D and E and K. These are all fat soluble, as well as magnesium. So it's like an orchestra. They all play in, their instrument in a synergistically coherent manner. So one vitamin or one supplement doesn't help, so it has to be all together in order to produce that beautiful masterpiece. Vitamin K is very, very needed for absorption of vitamin D, because vitamin D, with the help of vitamin K, can keep the amount of calcium in the blood in an optimal level, and calcium in the bones as well. So if you're not taking vitamin K, then calcium is being taken out from your bones and teeth to blood in order to keep that homeostasis. So you must take vitamin K with your vitamin A. There's a lot of supplement companies, they have it both together, vitamin D and vitamin K are together, so that you don't have to take two. So so if you are not taking vitamin K with vitamin D, there's a chance of osteopenia or loss of bone can be a result of that. So so I always tell people that through nutrition, through proper diet, through really helping your body to detox and receive the proper phytonutrients, is through eating lots of vegetables every day. So colorful rainbow vegetables, different colors, are all Again, just like different vitamins working together, these different colorful vegetables are working together in order for best absorptions. So eating one thing all the time doesn't help. You have to have variety of vegetables every day, different colors, like 5 or 6 colors each day, and each day you change your vegetable consumption in order to receive all. Dr. Terry Walls, MD, always mentions in her book, she's a bestseller as well, that make sure that each year you count your number of vegetables that you're taking. So it has to be above 200. So make sure that you get your 200 vegetables yearly. So I hope that this clip help you to realize how important is the food. Macronutrients and micronutrients all equally important in order to have the optimal health and best metabolic health. Thank you.